Prostate cancer is a type of cancer that develops in the prostate gland, which is a part of the male reproductive system. It is the most common cancer among men after skin cancer and the second leading cause of cancer death among men in the United States. 12. Prostate cancer usually grows very slowly, and finding and treating it before symptoms occur may not improve men's health or help them live longer too. However, if the cancer is detected early, it can often be treated successfully. The causes of prostate cancer are not yet fully understood, but there are some risk factors that have been identified. These include age, family history, race, and certain genetic changes. 1. Symptoms of prostate cancer may include difficulty urinating, blood in the urine or semen, and bone pain. 3. However, many men with prostate cancer have no symptoms at all. There is no definitive evidence that any specific food can prevent or cause prostate cancer. However, some studies suggest that a diet rich in fruits, vegetables, and whole grains may help reduce the risk of prostate cancer. Some foods that have been linked to a lower risk of prostate cancer include tomatoes. Some studies suggest that lycopene, an antioxidant found in tomatoes, may help prevent prostate cancer. In fact, a research team at Loma Linda University Health found that men who consumed canned and cooked tomatoes 5 to 6 times a week had a 28% decreased risk of prostate cancer compared with men who never consumed this food. However, more research is needed to fully understand the relationship between tomatoes and prostate cancer. Cruciferous vegetables. Vegetables such as broccoli, cauliflower, and kale contain compounds that may help prevent cancer. Fish. Fish that are high in omega-3 fatty acids, such as salmon, may help reduce the risk of prostate cancer. Pomegranate has been found to have some potential benefits for prostate health, according to a study conducted by researchers at Loma Linda University Health. Pomegranate, when combined with other polyphenol-rich foods, can significantly reduce prostate enlargement and cancer risk among men. Red meat consumption has been associated with an increased risk of developing prostate cancer. The World Health Organization suggests that both red and processed meats may be associated with increased risk of developing prostate cancer. According to a recent study looking at more than 175,000 men as part of the NEARB Diet and Health Study, meat consumption increases the risk of prostate cancer. The men who consumed the most red meat had a 30% increased risk of cancer.
In men and is highly treatable if caught early. But in the UK, 12,000 men die every year. The UK's death rate is twice as high as the US, Spain or Italy. MRI scans have been found to be more effective than the current blood.
Consuming large amounts of dairy products may increase the risk of developing prostate cancer. A cohort study published in 2007 suggested that consumption of milk and dairy products increases the risk of prostate cancer because milk contains considerable amounts of fat, hormones, and calcium associated with the risk of prostate cancer. Another study found that men who consume a lot of milk are more likely to develop prostate cancer than men who don't eat calcium-heavy diets. According to the Prostate Cancer Foundation and the American Cancer Society, there is currently no direct association between drinking alcohol and an increased risk of prostate cancer. However, a number of studies have investigated the effects of alcohol on enlarged prostate. Whilst there is a clear link between alcohol and worsening of enlarged prostate symptoms, the evidence is less clear in regards to whether or not alcohol actually increases or decreases the risk of developing the condition.
Is that a short 10-minute MRI scan used as a screening test can selectively pick up significant cancers in a much more effective way than the PSA blood test alone. That'll help us to diagnose the important cancers early when they're curable.
The prostate is a walnut-sized gland which sits below the bladder. It's the UK's most common male cancer, with 52,000 new diagnoses every year. This is what men over 50 can request from their doctor, a blood test for the protein PSA. High levels can indicate cancer, so it's a useful test, but unreliable.
Prostate cancer is a type of cancer that affects the prostate gland, which is a part of the male reproductive system. The prostate gland is responsible for producing seminal fluid that nourishes and transports sperm. Early-stage prostate cancer may not cause any signs or symptoms. Symptoms commonly noted during the advanced stage include trouble urinating, frequent urination, decreased force of urination, difficulty starting or stopping urine stream, blood and semen, pain or discomfort in the pelvic area, and bone pain. The exact cause for prostate cancer is unknown, but the following are risk factors. Advanced age, African Americans are at higher risk, family history, and obesity. There are no definite measures to prevent prostate cancer, but the risk can be reduced by following certain precautionary measures such as eating a healthy diet rich in fruits and vegetables, cutting down on fatty foods, having a regular exercise regimen, remaining physically active, maintaining a recommended weight, avoiding smoking and alcohol. The laboratory tests and imaging tests are recommended for screening and confirming the presence of prostate cancer. Treatments include chemotherapy, medications to stop hormone activity, radiation therapy, and surgery. These can be used alone or in combinations to treat cancer.
This is what men over 50 can request from their doctor, a blood test for the protein PSA. High levels can indicate cancer, so it's a useful test, but unreliable, as it's not always accurate.
Thank you for watching this video created by ACO Medical. Don't forget to subscribe and drop a like. Bye-bye.